Good day, everyone. My name is Sydney Flores, and I am here to present to you the Patient Record Management System. The Patient Record Management System, or PRMS, is a web-based system intended to provide a comprehensive record management system to the Premier General Hospital. So the first part of this presentation will discuss the problem domain. So let us now discuss the statement of the problem. Hospitals deal with the life and health of a patient, and they are especially important for rural areas where access to the healthcare is limited at its best. To this end, one aspect that tends to be overlooked in such hospital is the collection and maintenance of patient data and other hospital records. The hospital in question for the purposes of this research is Premier General Hospital located in Nueva Ecija, Baler, Aurora. The steadily growing population of Baler, along with the explosive increase in tourism in the area, means that there is a great risk of becoming under-resourced in handling the higher influx of patients, which leads to the following issue. Premier General Hospital still handles hospital and patient data using handwritten recording. The background and objectives of the project. Handwritten records carry a higher liability from human errors, from something as innocuous as bad handwriting, to misplacement, loss, and even damage. Thus, the goal was to create a comprehensive digital system that allows the hospital to track patient records and medical histories, and by extension, allowing patients to receive faster, more efficient, and more effective healthcare. Significance and scope of the project. A patient's medical record is the primary source of clinical information regarding a patient's history of care. Digital records, if maintained sensibly, allow for a robust way to quickly diagnose and treat a patient, and ultimately, raise the overall productivity of the hospital as a whole. The focus of the research is to study the following areas towards the development of PRMS. So, one is the patient's hospital records. 2 is the doctor's hospital records and schedule. 3 is outpatient emergency and admitting patients management. Clearance management of the hospital. Hospital and clinics referral process. And laboratories form and record handling. So we are now going to discuss the second part of my presentation, which is the review of existing alternatives. Based on the research into existing alternatives, the majority of similarly system lacks the security, the standard protocol, and procedures that must be followed according to medical sharing, retrieving, and viewing standards. These standards include but are not limited to DICOM, HL7, and HIPAA, and other data restrictions. So the part of this presentation, we're going to discuss the approach taken in this subject. So let us now discuss the theoretical framework of PRMS. So number 1 is the Hospital Information System, or the HIS. It is an integrated computer-assisted system designed to store, manipulate, and retrieve information concerned with the administrative and clinical aspects of providing medical services within a hospital. So the second is the relational database management. The huge increase of hospital patients in recent time has resulted in data mishandling. The rationale of the framework is to streamline, to secure, and maintain the integrity of patient data by storing it in a database as opposed to the continued use of paper materials and other manual forms of recording, which may easily become lost or, if available, may be unintelligibly as shown in the following screenshot. The PRMS was developed using standard software development tools such as PHP, MySQL, HTML, CSS, and JavaScript. For the configuration of the database, XAMPP or XAMPP is used, which stands for cross-platform, Apache, MariaDB, PHP, and Perl. PRMS was developed adhering as closely as possible to the needs of the hospital with regards to data management, as well as being compliant to what we have mentioned earlier in the review existing alternatives. We have to make sure that PRMS is compliant to DICOM, HL7, HIPAA, and other data restrictions. Once it is fully implemented in the hospital, its modularity not only allows the hospital to update it should it go further, but also allows it to be modified for compliance with other standards should the need arise. Plan for user testing and project assessment. The following questions were asked regarding the system. So, does the system work? Is the system used as anticipated? Does the system produce the desired results? Does the system work better than procedures if replaced? How well have individuals been trained to use the system? What are the anticipated long-term effects on the delivery of the medical care? Let us now discuss the results and the discussion of PRMS. The presentation of the system to the client was positively received. Particular attention was given to the interface, which was noted to be clean, intuitive, and legible even for users with poor eyesight. It was observed during use that the typical workflows of the departments served by the PRMS would be sped up due to the simplicity of the data retrieval as compared to their existing procedures. The lead client then expressed his desire to conduct user training and testing for all hospital staff as soon as possible, at which point it was discussed that there should be only one user per department in order to ensure the security of the records, and the overall training in question and implementation will be held at a future date. It has also been discussed that once the overall training has been done, the head of pharmacy and billing will decide as to whether they will connect the pharmacy inventory and billing process to PRMS. So, conclusion, the PRMS was successfully able to prove itself in the hands of the client as its different functionalities were observed. The basic goals of saving time spent manually looking for records as well as a clear, legible interface from which a user will read the data compared to inconsistent handwriting were fully achieved, and its overall worth was apparent to the clients in streamlining the processes of their hospital. Recommendation. The PRMS is highly recommended for PGH as their current system of operation is not designed to scale to the increasing needs of the locale of Baler Aurora. Both residents and, more importantly, tourists will be able to expect a high level of sophistication in the handling of their records as they receive their medical care. This will be especially useful once they transfer hospitals and an accurate account of their medical history is required. So that's all, and thank you so much.